Hello and welcome to this edition of Outlook Portion special series on nutrition and the pandemic. Our special guests today are Dr. Lindsay Jaacks and Dr. Ananya Awasthi. Dr. Jaacks has a dual appointment at the Department of Global Health and Population at the Harvard H.ChanSchoolofPublicHealth School of Public Health and the University of Edinburgh as the Chancellor's Fellow in the Global Academy of Agriculture and Food Security. Our current research projects broadly aim to advance understanding of the nexus between agriculture, nutrition, and health. Our research also involves improving the measurement of food environments and leveraging citizen science for public health nutrition. Now, if that sounds like a mouthful, I'm sure there's a lot more that I could add, but I'll leave it at that. Dr. Awasthi, who's been with us before, thank you so much for joining us. Dr. Awasthi is Assistant Director at Harvard Global Research Support Center, India, and the Harvard H.Chan School of Public Health, India Research Center. She works at the intersection of government, non-governmental organizations, and academic institutions to support the development of public health programming. She's an experienced global health research, management consulting, and policy analysis for public-led initiatives in low and middle-income countries. Thank you so much for joining us, the two of you. I'm just here to sort of, introduce the two of you. Dr. Awasthi will now take over and she will ask questions to Dr. Jaacks. I'll probably come back at the end. Over to the two of you. All the best. Thank you.
Thank you very much, Mr. Sen Gupta and the Outlook Group for putting together this important session, and a very warm welcome to Professor Lindsay Jaacks, my supervisor and mentor for the Portion projects at the Harvard India Research Center, and who's also a very dear friend. So here goes my first question to you, Professor Jaacks. As you know, nutrition, health, and agriculture are among the sectors which have taken a bad hit due to the COVID-19 pandemic. As someone who works at the intersection of these three subjects, how serious is the problem globally? And what are the short and the long-term implications on global food systems? And whether you would like to, throw some light on any specific implications for India.
Yeah, such an important topic. So I think there are really three things that immediately come to mind when I think about this in the context of COVID. The first is that we know obesity is the single most important risk factor after age for getting COVID and dying from it. And I think that point is often overlooked in the context of a lot of low and middle income countries, even though we know that the obesity pandemic has been a big issue in all countries around the world, from the US and UK to India. So just really all countries are impacted by this. So I think it's important to keep that in mind. And I think that this should really be a wake-up call to governments all around the world that they really need to get tough on industries that are causing the obesity epidemic. So I think that link between obesity and COVID is going to be a major driver of shifts that we're going to see in global food systems moving forward. The second thing that comes to mind is that the pandemic really highlighted the fact that most food insecurity around the world, including in India, is not because of a shortage of food production. India has been for many years now actually producing enough food to feed its population, and there's even a surplus in production. It's been a huge win for agricultural science in India that this has occurred. So it's not an issue of food production. It's more of an issue of access. And by access, I mean both physical and economic. So can people physically get to markets to purchase food, which we saw had major impact on that as a result of COVID. And also, can people economically afford to buy food when they get to that market? So I think that this pandemic has highlighted that if we're going to address food insecurity, we can't just focus on agriculture. We have to focus on the full food system, not just increasing production, because we're doing a really good job with increasing production. It's a matter of getting that food to people who need it. And then the third and final thing I think I want to point out is that the pandemic has shed a really bright light on One Health. Currently, most of the agriculture and nutrition health sector is really focused on crops, including my own work. It's very much focused on crops and crop diversity and the nutritional quality of crops. But the livestock sector is obviously going to be really important, particularly dairy and poultry, when we think about achieving nutritional goals moving forward. But you'd be surprised actually by how little consideration is given to transmission of infections from animals to humans in programs that introduce livestock in order to promote nutrition. So I think that as we move forward with more programming in the agriculture and livestock sector to promote nutrition, we really need to get veterinary medicine on board, because 70 to 75% of all new infections that are emerging, COVID being among those, are coming from animals. So as we start to promote more nutrient-dense, dairy products, for example, we need to keep in mind, this zoonotic spread of disease and One Health approaches to agriculture, nutrition, and health.
Thank you, Dr. Jaacks. Let me ask you a flip question. Alternatively, do you think that COVID-19 pandemic has probably forced the global food systems to increasingly rely more and more on local and traditional food crops, probably shorter supply chains and agro-food systems that are more resilient to global supply shocks?
Yeah, I think there's a lot of evidence to support that those shorter supply chains are a lot more resilient to these global shocks like COVID, but also other global shocks, for example, political unrest and war that we've seen in some places in sub-Saharan Africa and Middle East. So yeah, definitely shorter supply chains are more resilient. I think that the big issue there is that there's also a lot of evidence that those short supply chains can't meet all consumer nutritional needs in all parts of the world. And let alone food preferences. So if you think about certain parts of India, for example, you're not going to see a ton of food production. There's a reason that Punjab is the breadbasket of India. It's because it's a great place to grow food. And if you think about a place like Mumbai, which is home to almost 20 million people, you're not going to be able to feed 20 million people within a 100-kilometer radius of Mumbai. So I definitely think that these shorter supply chains are critical. I don't think that they necessarily need to be immediately local. I think we need to think about regional, domestic food chains, national food chains as well. Less reliance potentially on imported foods, for example, could be something to consider. So I definitely think that local and shorter supply chains are part of the solution. I don't think they're the whole part, and we need to kind of have a mixed bag solution to improving resilience in food supply chains.
That's very informative. Moving from probably back from global back to local, and then probably regional supply chains.
Exactly.
As you said. Right. Coming to health and nutrition, for the audience, would you like to share some of the evidence-based interventions that can be implemented in the South Asian context to ensure that everybody receives the proper amount of nourishment, portion, at both ends of the spectrum, between not having enough to really having too much?
Yeah. So this is definitely an area of great interest, both from a policy perspective, I think, and also from a researcher perspective. So much of the work so far and many of the interventions to date have been focusing on increasing the diversity of crops that are grown. Because there is some evidence, including from programs in India, that if you increase the diversity of foods that a farmer grows, the food diversity will also go up, diet diversity will also go up in those communities. Because agriculture is such a big part of big employer in India, almost half of the population is engaged in the agricultural sector, I do think that these types of programs are worth implementing and evaluating to understand the impact of these things at scale. A lot of the work that's been done so far has been kind of small scale projects. So I'm really excited about some of the work that's going on at the ministry in terms of trying to implement this crop diversification at a more regional level. I'm kind of going back to that regional food system as being key here. So I think that the crop diversification is definitely a key intervention that we should continue to explore. And I think it's important to keep in mind this very interesting paradox that most of the people who are undernourished in India are the people who are growing food. They're rural farmers. And so there's this question that I often ask myself, why are people who are growing food the least nourished people in India and really all around the world? And I think it really gets back to this question of access. Again, with COVID, it wasn't about production, it was about access to food. And I think it's the same case here. So I don't think that just diversifying crops without creating, for example, market linkages is going to work. So these things have to go hand in hand. Not only diversifying the crops that are grown, but also making sure that those farmers are linked to local and regional markets so that they can have more physical and economic access to diverse diets. So those, I think, are some of the key interventions. On the other side, I think we absolutely, as a priority, need to halt this shift towards processed foods in India and really all around the world. But those of us, in the UK and the US, we've already shifted to a very processed diet. So we've got a lot of backtracking to do. India, if you could just be ahead of the curve here and stop that shift to processed foods and emphasize whole foods, more traditional Indian foods instead, I think that would be a big win, not only for undernourishment, but also for obesity, which again is one of the biggest risk factors for COVID. I think things like fruits and nuts, they need to be staple foods, not just these special occasion foods that are prohibitively expensive for most people in India. Fruits and nuts should be part of everyone's diet. They're part of traditional Indian diets, and they could be promoted. Same thing with millet, sorghum, brown rice. These things should all be cheaper than polished white rice, but I have a folder of all of these pictures I've taken throughout all of India that show that those products are much more expensive. The white rice is way cheaper. You see them on the shelf in any retail store in India, and the brown rice and the millets and sorghum are always more expensive. So we've got to fix that. We've got to make these nutrient-dense foods affordable and available to everyone throughout India and just part of the diet, instead of things like sugary drinks, cold drinks. Those things are available everywhere. You can get a cold drink anywhere, but you can't get nuts anywhere. So can we think about ways to flip that, make nuts available everywhere, make sugary drinks the sometimes food that's only consumed on special occasions?
Right. Since you already spoke about crop diversity to dietary diversity, and especially the paradox about wherein we could probably look at market linkages for farmers. So I think my next question pretty much naturally falls into this, being that world over, as governments are realizing the importance of convergence between agriculture and nutrition. In this light, could you tell us a bit more about some of the strategies that are already being deployed globally or even in India?
Mm-hmm. Yeah, so this kind of takes us to the project that we're working on, this Poshan Atlas project. I think that it's certainly not the first project to work on convergence. MS Swaminathan's group has been working on this, and I can talk a little bit about that project that they've been doing shortly. But I think the thing about Poshan Atlas project, which is trying to create a data portal that brings together all of the agriculture data, all of the diet and nutrition data together in one place, is that that will show to everyone who accesses that portal that these things go together. Why would we talk about agriculture and agriculture policy without also considering the nutritional consequences of that? And so I'm really excited about that project because it's going to kind of make the default to consider nutrition in agriculture and nutrition policy. So glad that that's moving forward. But prior to that, as I mentioned, there have been some programs on farm systems for nutrition, for example, by the MS Swaminathan Association, where they're really trying to mainstream including nutritional criteria in the selection of crops that are farmed by farmers all across India. And they have done a study where they've promoted cultivation of millets, like I mentioned previously, millets and pulses, kitchen gardens where you're growing fruits and vegetables that are adapted to local environments, increasing access to poultry, nutrition awareness. So they kind of implemented all of these different nutrition-sensitive interventions in around 1,000 households in India, and they followed them up over 3 years. And they found that those interventions improved household consumption so that most people were consuming recommended allowance of all food groups and also had improvements in diet diversity. So that really, projects like that, I think, really demonstrate that if you focus on the production side, you can actually see impacts on the consumption side too. So those types of things I think are really promising and are going to be taken up at much larger scale moving forward. So I actually think India, you asked about governments in other places and how they're working on this. India, I would say, is at the cutting edge of this. They are the leader in this area. There are other governments talking about the links between agriculture and nutrition, but none are doing anything in a real meaningful sort of way. For example, the UK, there's been a lot of talk about a recent agriculture bill here related to Brexit, and very, very little talk about nutrition. In fact, in all of the coverage that I've read about this agriculture bill, nutrition is not part of it. Food safety is a big part of it, and that is of great import. But nutrition is not a major outcome that people are interested about, even though obviously what's produced here and what's imported here has an impact on obesity rates, which is our major nutritional concern here. So I think India actually, we're all going to be looking to India for examples of agriculture nutrition policy convergence, because that's just where most of the work right now is being done.
Right. Coming to your work in India and animal farming, what has been your experience working on initiatives related to zero budget natural farming in India?
Yeah, so not only are people going to look to India for agriculture nutrition convergence, but also for sustainable farming. So India is really a hotspot for adoption at scale of sustainable farming practices. And so people in the EU, UK, US, we're all looking to India to see what the impact of ZBNF will be. And other large-scale sustainable farming practices. ZBNF in Andhra Pradesh is just one of a handful of big programs, and several other states are also considering adopting ZBNF. So it's definitely a widespread shift in Indian agriculture to these more sustainable approaches. And I think the early results, it's still in the early stages of implementation, but the early results of small scale kind of plot level, just looking at, specific farmer plots, experiments comparing ZBNF to conventional farming in Andhra Pradesh show a lot of promise. So they're showing equal yields, so not a big yield gap, and also much higher farmer income, which you would expect, of course, if you don't see a drop in your yield and you're not paying for these chemical inputs, you're going to see a big boost in farmer income, which is a government priority. So it's definitely very promising. I think the one thing to keep in mind, again, early stages, there was one modeling study that was published in Nature Sustainability, which is one of the top academic journals, by a group of researchers actually here in Scotland at the University of Aberdeen. As I said, a lot of people are looking to India as an example for this. So what they did was a modeling study to kind of model what the impacts of this particular approach, ZBNF, will be in terms of soil nitrogen content. And what they found is that that ZBNF for farmers who are currently low input farmers, so farmers who are not putting a lot of chemical inputs into their farms right now, ZBNF will probably actually improve their yield. They'll have less soil degradation, soil health will go up, they'll get yield benefits. However, if you're a high input system, which is, a lot of farming in places like Punjab, for example, but also, large farms in Andhra Pradesh. If you're already putting in high inputs in terms of chemical fertilizer, you may actually see some yield penalties. So it'll be a mixed bag, and so we'll have to keep an eye on it to see what the net effect of all farmers, both low input and high input farmers, is in Andhra Pradesh. So I think we need to continue to keep an eye on this, but overall, I think there's a lot of promise in that. And in terms of our own work, beyond yield and income, which have really been the outcomes that have been studied so far, as you know, I'm a public health person. So my, primary interest is in health. And for a lot of farmers also, when you interview farmers who have adopted ZBNF and ask them, why did you adopt it and what have been the effects? One of the things that comes up actually quite often when you talk to farmers is health. So I also think of health as a farmer-centric outcome. Farmers don't just care about their bottom line, they also care about their health and the health of their families. So we're setting up a study, a natural experiment, to look at the both medium and long-term health effects of ZBNF. So we're particularly interested in things like respiratory health function, metabolic function. There's some evidence that pesticides are linked to diabetes and chronic kidney disease. And in kids, we're also interested in looking at cognitive development. Some of the pesticides, particularly the organophosphates, have been linked to impairments in cognitive development. So we'll be looking at kind of a widespread of these health impacts to see if the ZBNF program, by reducing pesticide exposures, can actually have important impacts on public health outcomes. So stay tuned for that. It's going to take time to see health benefits of something like this. We currently have a 4-year grant to look at, 4-year health outcomes, and hopefully we'll get a second tranche of funding to look at 10-year outcomes down the road, because these things will take some time to see, as did, the adverse health effects of conventional farming and high inputs and pesticides. It's taken years to kind of develop the chronic diseases that have resulted from those systems. And so similarly, it will take some time to see the health benefits of reducing exposure.
Okay. Since Lindsay, you already spoke about interviewing farmers, we know that you conducted telephonic surveys with thousands of farmers during the COVID-19 lockdown. Would you like to share some of the key takeaways? What were the challenges or even the opportunities that your research really shows?
Yeah, so as you said, we did this study really out of concern early on in the pandemic. Our first round of surveys was back in May, so several months ago, and we followed the farmers over time so we can see longitudinal effects. And it was really driven by early news coverage that kind of was covering farmers, dumping milk because they couldn't get it to cities, and all this, vegetables rotting in the field and things like that. So we were in the early stages really concerned about agriculture production in India. We were concerned that, for example, for the monsoon season that just happened, farmers were not selling their crops from the previous season. They weren't going to have the funds to put seeds in the ground for this monsoon season, and that would have long-term implications for food security. So that was really the underlying, driving concern for doing this study. And I will say that we had a sigh of relief actually after doing this survey, because we found that, as I mentioned before, there weren't really major disruptions in putting seeds in the ground, which would have been really bad for next year, for the end of this year and for next year. The biggest disruptions were really early on when the lockdown first happened, and there were major restrictions on transport, so things couldn't get to the market. People lost their wages, and so demand bottomed out in cities. And so, it was really those kinds of disruptions that caused the greatest impact early on. And then for the subsequent season, there weren't as many disruptions. So everything proceeded as we might have expected without major significant disruptions, at least in our sample for the monsoon season. So that was very, good news. I think another, just to share a little bit more good news, which we're all a little desperate for these days, another interesting finding of that study was that when we looked at farmers in our study who mostly lived in rural areas, we found actually less evidence of major food insecurity, severe food insecurity, which is skipping meals or going a whole day without eating, so going to bed hungry. We didn't find as high of a level of that in this particular sample as compared to studies that at that time were reporting major food insecurity, especially among migrant workers in cities. So we found that these farmers in rural areas were a bit more resilient. And that goes back actually to the first point that you made about these local food systems being more resilient. So part of the reason that these farmers reported reduced food insecurity is that they were consuming the harvest that they couldn't get to the market. And they were also sharing it with community members so that community members also didn't have as much food insecurity. We also found that a lot of the farmers reported receiving extra food rations from the government. So PBS and additional measures to address food insecurity were also working in these areas. So overall, I would say that the results were not as worrying as we would have expected. We are seeing some impacts in more vulnerable groups in our sample. So for example, landless farmers were 10 times more likely to skip a meal compared to medium and large farmers. So the vulnerable groups definitely continue to be vulnerable, and we need to continue to reach those people with emergency food rations and other support measures. But overall in our sample, not as bad of an impact as we had expected. And it was definitely the migrant workers in cities who seemed to have the biggest impact in terms of food insecurity immediately following the pandemic response measures.
Right. So as you said, we're all looking for some good news these days. And it's no surprise that the agriculture sector, in fact, sort of outperformed, the expectations that people had. And that says a lot about, how important agriculture is as a sector, not just for the economy, but for livelihoods and public health and nutrition. Coming to the Nobel Prize, which has, of course, been awarded to the World Food Programme, what do you think it says about the global policy focus on food and nutrition security? What are your thoughts?
Yeah, well, I'll say that I was, very relieved and also so excited that the award went to WFP. I think it really suggests that there's a global shift going on in terms of pandemic response. So with any pandemic, the immediate response is, we've got to get the infectious disease and the spread of this disease under control. And then at some point, you've got to shift to all of the other stuff that happens as a result, the economic and social consequences especially. And so I think it demonstrates that we as a global community are shifting in that direction. We're realizing that there are going to be major impacts, particularly of the economic crisis that's resulted from the pandemic on food security. So World Food Programme published a report earlier this year that was actually their annual report for last year. And in 2019, last year, before any of us had even heard of COVID, actually food insecurity was already starting to have an uptick. And most of that was because of political unrest in Middle East and in Sub-Saharan Africa. But it was already starting to tick upwards. And some of that was also related to climate change. But they predicted that as a result of the economic crisis and supply chain disruptions associated with COVID, that number was going to double. So 250 million people are estimated to be food insecure by the end of this year, according to WFP. And so I think that this Nobel Prize was really recognizing that, we've got our work cut out for us over the next couple of years to build back and World Food Program will have to be a big part of that. I mean, they're currently only serving, just under 100 million people. And so if they're going to have to triple the number of people that they are serving, I really hope the Nobel Prize will get them more financial backing for World Food Program, but also other UN agencies who are going to have to work on, addressing the social and economic effects of this crisis. So really big win, I think, super exciting, and I hope it does lead to more resources for them to do the work that we're going to have to do to feed more people moving forward.
On that note, thanks for sharing these deep insights, and I would say in a very easy to understand language. I mean, public health and knowledge translation is a big part of what public health practitioners do. So thank you so much, and over to you, Ram.
Thank you. In fact, I'll have to take lessons from you, Dr. Awasthi, on how to conduct an interview within that stipulated time. I really need to do that. And thank you so very much, Dr. Jaacks, for joining us today. That was Dr. Ananya Awasthi and Dr. Lindsay Jaacks' conversation today on the impact of the pandemic on food security. I look forward to having the two of you again someday soon, both individually and separately. Thank you so much. Have a great day.
Thank you. You too.